I would like to present the procedure on how to do the ear acupuncture in our patient. But first, we have to look at the materials needed while doing this acupuncture, because we have to set up all the acupuncture materials needed to do that ear acupuncture. First, we have the charts. Okay, the ear acupuncture charts basically will help us to easily locate the points that needed to be punctured in the ear. Okay, so this will be our guidelines, enable for us to locate what specific points we are needed to put that needles or the seeds. Okay, we have also some textbooks or some guidelines that I'm going to give it to you. These are specific in areas where you want to do the acupuncture points. Like here, for the lumbar pain, we have specific points located here, the chart, that will give you exact locations of the acupuncture points in the ear. Okay? But generally, we have this in our mind that the ear points is just like an inverted fetus, as I said before. The head parts or the ear points that correspond to the head is on the lower lobe of the ear. The internal parts will be the internal organs, like what you see on this chart. Okay? As well as this, we can have also some ear models like what we have here. But the ear models, basically, we can because this is produced in China, that's why the location is in Chinese. The label is in Chinese. That's why I put some points or talks to label it on their English correspondence according to what acupuncture points that we needed. So we have also ear models and ear charts that will help each and everyone to locate the points. Okay? So these are the basic needed materials for in locating the acupuncture points in the ear. Okay, the next one is this. We have to how to locate the points. Okay, in locating the points, there are several things needed. Like there is an acupuncture point detector for the ear. This is the point that we can. This is the materials that can be used in locating, because you need a probe to be attached on this machine, and the patients will hold one of the probe and the other one is to probe it in the ear, and it will produce sounds. But unfortunately, we don't have the probe here. That's why I'm going to use what we call the traditional one. I'm going to use the stick in able to probe the ear, like doing this and in the ear by locating it and probing its exact points and determine which is the most painful part that we're going to put the seeds. Okay, so this time I'm going to use and specifically this stick as a probe to locate and stimulate the points of the ear. Okay, so it is also very important. We have also the cotton buds and the alcohol which is needed in able to disinfect or clean the ear. Okay, so we have this one to use to clean the ear before we do the inserting the needles or putting that seeds along this area of the ear. We have to remind that the ear basically is more cartilage. So the supply of the blood here is not that much, so that disinfections or cleaning this area before putting the seeds or the acupuncture needle is very important, because to prevent and avoid infection. Okay, that's why cleaning is very important, or disinfecting. Then the most important thing is the seeds that we are going to use in able to stimulate the acupuncture points in the ears. Normally, we can buy in other acupuncture stores the seeds as some are like these magnet metals, no? A metal seed which is magnet, okay? But at this point, we don't have that much stocks with here. That's why we're going to improvise the use of what we call mustard seed. Okay, this is the mustard seed. And we're going to use this? We're going to put it on the tape. Okay, we need the tape. Okay, and then we're going to put these seeds along this tape like this. This is already a pre-cut. Okay, like this. Okay, and this is the one that we're going to use to put in the ear, and it is the one that will stimulate the acupuncture points in the ear. Okay, so now let's go now to actual demonstration on how we are going to put that seeds, locating the ear points, and putting that ear seeds in the ear. And it's very easy. All we have to do is to prepare all the things that we needed, enable for us to facilitate fast and easy, and it will become for us to do it very easy for ourselves or to our friends and family. Okay, after presenting to you the materials that we are needed to use to do the ear points or the ear acupuncture, we're now going to demonstrate to you on how to do the acupuncture needling techniques or the ear seed applications on the ear points. Okay, let's go now and proceed. Now, we have this to prepare the ear by cleaning it first with our, what we call this, cotton bud soaked with 70% isopropyl alcohol. Okay, which is very important to disinfect. Okay, first. So, first we have to clean the ears with this one. So, first we have to clean the inside of the part of the ear, and then we have to go to the outside part of the ears, where it's better to clean all the ears. Okay, so from inside and to outside. Okay, like that. So, we're going to repeat again the procedure to clean second time round from inside to outside. Okay, then after that we have now to use what we call our stick to use as a probe to locate the specific points that we are going to put the ear seeds. First, we have to choose or locate which area. Like for example, I'm locating what we call it Shenmen acupuncture points on this area, on the triangular fossa. Like if you're going to observe, there is some like pimple like skin on this area. That's I'm going to probe and ask the patient if this is more painful. Is it painful?
Yes.
Okay. Or the second one?
The first one.
The first one is more painful. Means that the areas where there is a lesion, it is most painful, then that is the point to be selected. Okay? So, now we are going to put this ear seed to this area that we selected. Okay, as we see, there is still a mark between 1 and 2. So we have to put the seeds on the first mark. Okay? Then we're going to fix the tape, enable the seeds not will. Okay, like that. See that? Okay. And then you will ask the patient to press it at least 1 minute per point. Okay, we will just demonstrate 1 point for you, enable for you uh, uh, to apply the tape and seeds along that ear points that needed to stimulate for that pain, to relieve the pain.
Yeah, yeah, yeah.